Alternative Patient Solutions is a low-cost option for toxicology testing for patients with high deductibles or no insurance at all. Increasing insurance premiums have led many patients to select plans with a higher deductible. The average deductible for a family plan is roughly $8,000 in addition to the average premium paid by families, which is roughly $10,000, putting the maximum out-of-pocket at nearly $18,000 per year. To make matters worse, many plans count diagnostic testing toward the patient's deductible first, so the patient has to come out of pocket to pay for the test. When a claim goes through insurance, a patient is left with a balance bill, which is usually between $300 and $400 for a toxicology test. For a typical patient getting 4 tests done annually, this means $1,200 to $1,600 out of pocket. Roughly 30% of diagnostic testing is currently cash pay, so this is a problem felt by many patients. Needless to say, patients are experiencing huge financial burdens. Alternative Patient Solutions has developed a program to lessen the financial burden for patients. In lieu of going through insurance, patients can pay a $175 flat rate. On average, this saves the patient roughly $500 per year. These tests are performed by accredited laboratories, CLIA and CAP certified. The labs have the ability to run both urine and oral toxicology specimens. There are 2 options for clinics to offer this to their patients. The first option is to simply have the patients pay directly through the APS website. The healthcare provider will fill out the requisition form and send it in just like any other lab test, only they will not need to include the patient's insurance information. If the patient does not have a credit or debit card, they can send a check along with the requisition form and specimen. The second option is for the practice to collect the money directly from the patients. The practice will then be billed monthly at a rate of $150 per test. The practice can charge the $175 or any amount they wish. The difference between the charged amount and the $150 is the collection fee that the practice can keep. To get your practice started, you'll need to complete the practice registration form. This ties any specimens received from that practice back to the distributor. Distributors will be paid monthly at the rate of $20 per specimen. If you would like more information about adding this or any other program to your sales portfolio, you can sign up directly by visiting everyancillary.com. You may also subscribe to our YouTube channel to find other medical sales training videos. To stay on top of all the latest medical ancillary programs and industry trends, you can also subscribe to the Medical Ancillary Sales Podcast and Medical Practice Trends Podcast. Of course, you can also follow us on Twitter, where you can find the most up-to-date information about the medical ancillary sector, so you can stay a step ahead of the competition. Our Twitter handle is everyancillary. Links to subscribe to each of these are provided in the video's description.